Hello everyone, myself Kaushika Praveen Heda, and today my topic is general anesthetics, wherein we'll cover the following subtopics: general anesthesia, mechanism of action of general anesthetics, stages of general anesthesia, pharmacokinetics of inhalational anesthetics, and inhalational anesthetics. Now, general anesthesia. These are the drugs which produce reversible loss of all sensation and consciousness. Features of general anesthesia are loss of all sensation, sleep, unconsciousness, and amnesia, immobility, and muscle relaxation, abolition of somatic and autonomic reflexes. Now, classification of general anesthetics. General anesthetics divided into inhalational anesthetics and intravenous anesthetics. Further, the intravenous anesthetics again divided into two: the slower acting and the inducing agents. The slower actings are the dissociative anesthesia, opioid anesthesia, and the benzodiazepines. Dissociative anesthesia example is ketamine. Opioid anesthesia example will be fentanyl, and benzodiazepines like diazepam, lorazepam, and midazolam. Inducing agents examples are thiopentone, methexetone, propofol, etomidate, etc. Inhalational anesthetics again divided into the two: gaseous ones and the volatile liquids. Gaseous example is the nitrous oxide, and volatile liquids examples are halothane, enflurane, isoflurane, desflurane, sevoflurane, and methoxyflurane. Mechanism of general anesthesia. Mechanism of action of general anesthesia is not precisely known. A wide variety of chemical agents produce general anesthesia. General anesthesia action had been related to some physicochemical property of the drugs. Mayer and Overton pointed out a direct parallelism between the lipid or water partition coefficient of general anesthesias and their anesthetic properties. MAC, it is the minimum alveolar concentration. This is the lowest concentration of the anesthetic in the pulmonary alveoli needed to produce immobility in response to a painful stimulus like surgical incision in 50% of individuals. Now, MAC is inversely proportional to potency. Inhalational anesthetics, barbiturates, benzodiazepines, and propofol potentiate the action of inhibitory transmitter GABA to open the Cl- channels. Action of glycine, which is one of the inhibitory transmitter which also activates Cl- channels in the spinal cord and medulla, is augmented by barbiturates, propofol, and many inhalational anesthetics. Ketamine selectively inhibits the excitatory NMDA type of glutamate receptor. Certain fluorinated anesthetics and barbiturates inhibit the neuronal cation channel gated by nicotinic cholinergic receptor. Stages of anesthesia. General anesthesia is described under 4 stages, which are clearly seen only with the ether anesthesia. Now, stage 1 is the stage of analgesia. It starts from the beginning of anesthetic inhalation and lasts up to the loss of consciousness. Stage 2 is the stage of delirium, from loss of consciousness to the beginning of regular respiration. No stimulus should be applied or operative procedures should be carried out during this stage. Now, stage 3 is the surgical anesthesia. It extends from the onset of regular breathing to the cessation of spontaneous breathing. This is divided into 4 planes. Plane 1, rowing of the eyeballs, is present. Plane 2, loss of the corneal and the laryngeal reflexes. Plane 3 is where the pupil starts to dilate and the light reflexes are lost. Plane 4 is the intercostal paralysis and shallow abdominal respiration is seen. Now, stage 4 is the medullary paralysis, wherein the cessation of breathing to failure of circulation and death is present. Now, here is a diagram that explains the 4 stages of anesthesia. So, now we'll see the stage 4, that is the medullary paralysis. Here it is seen that the respiration, thoracic as well as the abdominal, both is completely stopped. Ocular movements absent. The pupil size is seen that the pupil has been dilated completely, that is the complete mydriasis is present. All the reflexes lost. The skeletal muscle tone, blood pressure and heart rate, everything lost. Therefore this stage, that is the stage 4, shows that the death has occurred. Now we can see the stage 1, that is the stage of analgesia, wherein the thoracic and the abdominal respiration rate has increased and it keeps on fluctuating. This shows that it is just the beginning of the anesthesia. Now the ocular movements here are normal. Pupil size is normal. All the reflexes, skeletal muscle tone, blood pressure and heart rate, everything here is present and is normal. So therefore this This stage is used in labor incisions and minor operations. Stage 2, that is the stage of delirium. It is not as such a significant stage, but yeah, it is used in order to avoid the trauma to the patient. Now stage 3 is the surgical anesthesia, wherein it is divided into 4 stages or the 4 planes, that is the plane 1, 2, 3 and 4. Here we can see that the reflexes goes on decreasing as we move towards the last plane, that is the plane 4th. Also the heart rate, blood pressure and the skeletal muscle tone also keeps on reducing. Even the respiration reduces gradually. So therefore this stage is used in most of the surgical operations, and the surgical incisions are carried out in this particular stage. Induction, maintenance and recovery. Induction is defined as the period of time from administration of anesthetic to the development of effective surgical anesthesia in the patient. Maintenance provides a sustained surgical anesthesia. Recovery is the time from discontinuation of administration of anesthesia until the consciousness and the protective physiological reflexes are regained. Pharmacokinetics of general anesthesia. Pharmacokinetics is the relationship between a drug's dose, tissue concentration and the elapsed time. That is how a body affects a drug. Absorption, distribution, metabolism and excretion are 4 processes which we'll see under pharmacokinetics. Now uptake and distribution of the general anesthesia. Inhalation is via the nostrils, then it goes to the trachea, then the bronchus, bronchioles and ultimately the alveoli. Here a specific factor, that is the blood gas coefficient, that is the one which tells us how much drug is in the dissolved form in the blood and how much is present in the free form. This blood gas coefficient is inversely proportional to induction. Metabolism of general anesthesia, here no or minimal metabolism is present. Excretion of general anesthesia is via the lungs, again in the form of the exhaled air. Means as we took it in the same form it will go out. Inhalational anesthetics. Inhalational anesthetics are the chemical compounds delivered via inhalation that can be used for induction or maintenance of general anesthesia. Its purpose is it is used during a test or a surgical procedure to achieve amnesia, unconsciousness, immobility and stunted pain sensation and response. Measurements. Minimum alveolar concentration, that is the MAC, blood gas coefficient and bispectral index monitors. Examples of inhalational anesthetics are sevoflurane, desflurane, isoflurane and the nitrous oxide. Now we'll see the individual drugs. So first, nitrous oxide. Nitrous oxide is the one which shows the second gas effect when combined with halothane. It is also called as a laughing gas. It shows diffusion hypoxia. It has analgesic property and it is a poor muscle relaxant. Now halothane. Its advantages are bronchodilation, therefore it can be used in bronchial asthma. It is a uterine relaxant. It can be used in children. Disadvantages: it is a poor analgesic and a poor muscle relaxant. It is a CVS suppressant, therefore it sensitizes the heart to adrenaline and it can cause arrhythmias. Hence it is contraindicated in pheochromocytoma. Ether. It has pungent odor, it is inflammable, it is a good muscle relaxant and an analgesic. Isoflurane. It has pungent odor, it maintains CVS stability, therefore it is preferable in cardiac patients, especially in the ischemic heart diseases. Desflurane. It is used in daycare induction, it has fast induction and fast recovery. Sevoflurane. It is used for induction and maintenance. It is preferred in children. It is not used in a closed system because it can cause toxicity. Now let's see some questions. So the drug showing second gas effect would be, options are N2O plus halothane, second sevoflurane, third ether and fourth none of them. So yeah, the answer would be N2O plus halothane. Which of the following is not an inhalational anesthetic? First option N2O, halothane, third propofol and fourth desflurane. So yeah, answer would be propofol. It is an intravenous anesthetic. What among the following is incorrect as a mechanism of general anesthesia? So first option, increase in GABA activity, second K plus channel opener, third CNS stimulation and fourth is glycine agonist. Yeah, the answer would be CNS stimulation. It is the general anesthesias here are CNS depressants. Thank you.